What is the most common misconception when it comes to rhinoplasty? For Filipinos and Asians, we all thought that rhinoplasty is just about elevating the bridge, making the bridge look higher. But actually, that is just one out of maybe 10 concerns when it comes to our surgery whenever we do rhinoplasty. So I will use my nose as an example. So if you can see, I actually have a bridge. So not much augmentation is needed. However, I have a wide bone here, and for others, it is more prominent. So for other people who actually have very high bridge or very prominent bone, then that should be addressed as well. So it's not going to be helpful if you put a lot of implant in here, put silicone or Gore-Tex. It will just make the case worse. However, what might need to be done may be rasping to decrease that one, and for those with wide nasomaxillary area here, some osteotomy may be needed. So osteotomy is when you crack the bone and push it together to the midline so that it will be slimmer and it will also elevate. And that is just one part. This is the dorsum. And the other concern would actually be the tip. So this one. So we have the tip here, and the tip is ideally quite pointed like this one. And for those with the bulbous tip or the ones with large and fat tip like myself, so it needs to be reconstructed in such a way that it will be projected like that, and it will also turn downwards. So this one, this is derotation. And mostly it is addressed by just putting like an L-type silicone here. However, that might not be so good long term because eventually our soft tissue, the support inside, might be jeopardized as we age, and that can lead into like extrusion or drooping of the nose over time long term. That's why what we do usually is we reconstruct. So what we do is we open it up and then we put support on the inside. We can use mesh or we can use the septum depending on the integrity of the nose when you open it. And that's why, so that when we put a graft in here, it will be fully supported, and once it will heal, it will be just like a natural septum, natural support from the inside, but it's now moved forward, and then that is where you can now put the graft so that it will increase the tip. So we can add here a little, and then it will be projected already, and then it will be rotated already, and that's going to be long term, and how it will heal will be like natural. And the last part that we usually address is the ala. So the ala, it can be addressed by two ways: by making a cut or incision in the inside, what we call as sail incision, and popularized by our very own Dr. Edward Yap, my mentor and my surgeon. And it's making a sail incision here so that it will be like this and this one. However, if the whole skin is still big, there's still excess tissue when it comes to the ala, then an incision or an alar based surgery or a wedge excision can also be done. So we usually cut in here so that it would be moved a little up and also a little turned and smaller as well. So it might quite be hard to imagine, but don't worry, soon my surgery will be over and you will see what I'm talking about. But for now, just know that rhinoplasty is not just about providing the bridge. There are a lot of rhinoplasty that actually doesn't need augmentation, meaning there's no need for implant, there's no need for any addition when it comes to the height of the dorsum or the bridge of the nose. So if you are interested to have rhinoplasty, talk to your surgeon about it. If you have a nose that you'd like to have, like an inspiration nose, know that there might be limitation, but discuss it with your surgeon, with your plastic surgeon, with your rhinoplasty surgeon, and they will explain to you how the procedures will happen. So God bless on your own journey towards betterment, towards improvement. I'll see you in our next video. This is Dr. Josephine Grace Rojo, also known as the Diet Doctora, and in here for this special vlog series, I am a plastic surgeon undergoing plastic surgery myself. Thank you and have a good day. Bye!